So, Dr. Stein, we've been talking about prostate cancer and the importance of screening to actually detect it because symptoms are not a good way to know whether a person has prostate cancer. So, when we're talking about screening, tell us more about the different tests that are used for screening, and can that distinguish between cancers that are aggressive versus ones that are less aggressive and less dangerous? And are there particular people who should get screened, and at what age or what point in life should they get screened?
Yes. So again, our typical screening test has been the PSA blood test. Historically, we've been starting that at the age of 50. More recently, over the last few years, there has been some controversy about whether screening is necessary, whether it is helpful, but the American Urological Association, which is our main urologic association in America, has suggested that between the ages of 55 and 70, at the very least, men should undergo screening. There is a reasonable thought that perhaps we should screen even a little bit earlier than the age of 55. Some suggest that maybe getting a baseline PSA test or sort of an initial test to kind of see if this gentleman or if a person is more likely to develop cancer at a younger age, maybe at the age of 40 or 45, instead of waiting all the way till to 55. But there is a significant amount of controversy about when exactly to start screening. I strongly think that screening is helpful. It is, I think, a very necessary thing to prevent more aggressive cancers in our population.
Okay, thank you. And so the first test is the PSA, which is my understanding is the prostate-specific antigen. It's a protein that is produced by the prostate. And if I'm understanding correctly, it's more abundant in someone who has prostate cancer. So we get a higher level. Is that right?
Correct. Yes, we do. If the PSA is too high, then that suggests that the man may have a higher likelihood of having prostate cancer. The problem with PSA is that it is not absolutely specific to prostate cancer. So the prostate is the only organ that makes PSA, but if the prostate has some inflammation that's benign, and there is actually no cancer, but but the prostate is inflamed, it can give off too much PSA, and therefore there are other situations, or it may be an enlarged prostate, again, that doesn't have prostate cancer, that also can lead to a higher PSA level in the bloodstream. So we do need to follow up a high PSA with a biopsy just to be sure that this is from cancer. There are other tests that are being developed and even have been developed already. There's one from a company called OPCO called the 4K test. Presently, there's one called PCA3, which is a urine test. And these are tests which have been developed, which seem to be a little bit more specific to prostate cancer, where there's not as many, we call it false positives, where the test is abnormal due to some other problem besides prostate cancer. So I think that there is excellent development of newer tests in the future that are very exciting and that will improve our ability to find cancers and not so much and decrease the incidence of having biopsies which are unnecessary, which are negative. So there's a lot of development in this area of better screening tests than PSA.
Right. So it sounds like the benefit of getting better screening tests is there'll be less false positives, and people will have to have less biopsies and other testing. It's interesting, one of the things you mentioned was that an enlarged prostate can actually result in a high PSA. And if I understand correctly, that would be another case in which someone might have difficulty urinating. So you could have two men both with difficulty urinating, and one could have just an enlarged prostate, which is a completely harmless problem, and then someone could have a prostate cancer. So making that distinction is really what it's all about, it sounds like.
Yeah, absolutely. We can't tell just clinically, just by asking patients and discussing with them and examining them. We can't tell with prostate cancer if they have prostate cancer. So we really need these additional tests, these screening tests, biopsies, in order to tell us whether they do or don't have cancer.
Right.